International Relations Minister Dr. Naledi Pandor has joined the list of those hailing Dr. Tlaleng Mofokeng's appointment as the UNHRC's Special Rapporteur. Pandor says the appointing team at the United Nations noted Mofokeng's legal expertise, knowledge of the United Nations system and experience at regional level, as well as her commitment and expertise in gender equality. Well, what exactly is she going to be focusing on? Dr. Mofokeng joins me now to talk about this new chapter. It's absolutely fantastic news. You've been an activist for a long time. You've been part of South Africa's very own Gender Commission and doing great work there. But I imagine, being nominated and being appointed to this post is probably a much bigger deal. Tell us about how you received the news.
Thank you so much, Tessie. I mean, it definitely is a big deal. I think, whenever I do these types of interviews, I remind everyone who because that locates, the importance and the significance of the work, but also, a person that looks like myself, who can be called upon by an institution such as the United Nations Human Rights Council, to lend their expertise and advise on what should be happening in really promoting and protecting human rights of all people, and I think that's a task I don't take lightly, and I'm equal, to that task.
Sure. Part of what it also recognizes is perhaps years of work that you have been doing behind the scenes, but also being quite vocal about some of the issues that are affecting women, not just in South Africa, but on the continent, and raising and being a voice for those issues, regardless of whether or not they've been picked up by mainstream media.
Yes, and that's the hardest work, right? And that's the work that requires a lot of longevity. And even in this role as an independent expert, of course, we are called special rapporteurs. It is important to talk about the fact that, they also appoint people who have a track record of doing human rights work. And of course, in my thematic area, it's about the right of everyone to enjoy the highest attainable standard of physical and mental health. But there's so many other intersecting issues that determine positive health outcomes, such as access to safe potable water, sanitation, occupational health and safety, environmental health. And I think it's about bringing that view, to the United Nations, but with an unapologetic, African Black woman experience, because that is my lived experience. And it's a lived experience of many people in our country, in our continent, and as well as globally, as we often hear about the statistics, around healthcare outcomes. So much.
What are the key issues that are going to be on the agenda for you to bring to the attention of the world? But I imagine that as you serve your term, you'd be looking at certain things where by the time your term comes to an end, that you're able to point to in terms of your efficiency in this role.
Definitely. I mean, there are minimum requirements for the UN Human Rights Council, such as, preparing a report as well as tabling a report for the General Assembly. And that's important because it's speaking to the general trends that are happening in the world. But there's also issues around country visits where, I will be undertaking them to investigate and further report on any violations of human rights pertaining to the right of health. And I think for me, a specific, a theme that I want to focus on or elevate, it's the issue of vulnerability being everyone's right. And that if you are vulnerable by either race, class, gender, or geography, or being differently able to an occupation that you do, doesn't mean that states or other citizens should take advantage of you. So it's about elevating that, because I really believe that's one of the important ethics around vulnerability and respecting vulnerability, and working to ending all discrimination.
And in fact, when we look at many of the human rights abuses that are taking place in multiple countries, they in fact show that there is no recognition of vulnerability, that there isn't a space for human beings to be even one bit vulnerable, whether it's refugees or whether you're talking about women, because so much seems to be up against different people at different times.
Yes, and our responses to that, and my challenge to the member states would be to center people's dignity and body integrity. And because regardless of what people don't believe, at the end of the day, human dignity is what's important. And all the solutions, all the policies, any local or regional laws, any criminalization should be pushed back against if they are going to infringe on other people's dignity. Because as COVID is showing us, we already know the existing fault lines in many systems around the world, including our own. It's how we respond to that now that will either promote and protect existing rights, and then also ensure that the generation coming has a planet, that is healthy and well, and that the human population is equally taken care of, so that we don't excuse the failures of member states and then end up with philanthropication of healthcare, as we see in many global South countries.
What does that mean then for the work that you'll be doing in South Africa? Does it mean that we're going to be seeing you have less of a presence locally when we have issues, when we have protests? Does it mean you're no longer going to be at the forefront of those protests? I'm sure you can tell I'm getting emotional about it already.
Not at all. I'm not an employee of the United Nations, and what's great about this role is that you are an independent expert, and the work of the Human Rights Council as a special rapporteur feeds in directly with the work I'm doing at the Commission for Gender Equality. Of course, our mandate at the Gender Equality is about promoting and advancing, promotion of gender equality, and of course, we know that we can't get gender equality if women are sick, if children are ill, if the elderly are not taken care of, if people of different gender and sexual orientation are continued to be criminalized or marginalized. So it is very important, I think, for me to bring on my experience at the Gender Commission and draw on from the extensive research and some of the groundbreaking, legal reports that the Commission has issued, and elevate that work and really influence. And I think this is the moment that as a country, as an institution, we can really look back because it gives us an opportunity to bring our values, our mission and our vision to a global space.
Tlaleng, it's absolutely fantastic news. I imagine after this you'll be running for president, right?
Yes. Not sure. I think the human rights work, there's lots of work there, so that's where I'll remain.
All right, Dr. Tlaleng Mofokeng, thank you so much for coming on to News at Prime tonight. I knew I'd get you good with that last one. Absolutely fantastic news for her, South African, that's really showing us how to lead, and not just locally, but internationally too. So we certainly wish her all of the best in this new role.